A growing number of physicians from the United States are looking to move to Canada following the election of President Donald Trump. That's according to the Canadian Medical Association. We spoke to Dr. Joss Reimer, president of the Canadian Medical Association, about how this growing interest could help address key gaps in the Canadian healthcare system, from emergency room wait times to physician burnout.
Well, we have a major issue with a physician shortage in Canada. That's the health human resource shortages are probably some of the biggest problems we have in our health system. We know, according to Health Canada, we're 23,000 family physicians short in this country, and there's no one solution that's going to solve that. But seeing some interest from US physicians wanting to come to Canada is part of the solution, and we need to be putting in every solution that we possibly can at the same time to try to address that gap. And we are seeing interest through the physician recruitment firms, through the Medical Council of Canada. And so we are trying to work with the provinces and with the federal government to hopefully fast track visas and immigration processes and licensure in Canada. When you don't have access to a family doctor, particularly, that can cause all kinds of stresses along the line in your own health and for the system, because either people are getting their primary care in emergency rooms or they're not getting that care at all and their health needs are getting more complex and now they actually need those emergency rooms or hospital beds because they weren't taken care of in the community. So we want to make sure we have a strong primary care system that's there for Canadians to keep them healthy and keep them at home.
Dr. Reimer also explained why it's so important to speed up the credentialing process for doctors trained in the U.S. and what challenges still make it hard for them to fully integrate into the system.
It is critical that we make sure that everybody who wants to contribute to our healthcare system in Canada has the opportunity to do that. When we have 6.5 million Canadians who don't have access to a family doctor, we need to be coming up with those solutions. And that means helping those physicians who are already here in Canada to safely practice and contribute to the system. But it also means helping the US doctors who right now are more interested than ever in coming to Canada, helping them get through the immigration process and get their licenses. You have to be licensed in whatever province or territory you work in. And some of the provinces in Canada already fast track US physicians, but not all of them. So we want to see that get expanded so that when US physicians show an interest in Canada, that we can help them get into the system because their training is quite similar to ours. If they're working in English communities, typically their language is not a barrier. They have a similar culture, although not identical. And so we want to make sure that we're helping get those physicians who could contribute into the workforce as fast as possible.
And finally, we discussed what Canada should do next to not only attract but retain American physicians to help build a more effective Canadian healthcare system.
Well, the thing is, they're already interested in coming. They see Canada as a place where insurance companies and politicians don't get to dictate how you practice medicine. And that's not the truth in the US, where right now there's political interference, and there's been for many, many years insurance company interference in medical decision making. And so we want to show them that this is a great place to work. Yes, we have challenges. There's absolutely things we need to do to improve our system. But one of those challenges is that we don't have enough doctors, so they can be part of the solution and help make this system stronger.